Well, mental health certainly an issue on everyone's minds at the moment. Well, for more perspective on that, I'm joined live via Skype by Dr. Alfiee Breland-Noble. She's a psychologist, author, podcast host, and the founder of the AAKOMA Project, a youth mental health nonprofit. Welcome to the show.
Thank you so much.
So for people who aren't familiar, what is health anxiety and how will people recognize if they're being impacted by it?
Absolutely. So health anxiety is really just worry that's outsized proportion to what a person might normally experience. We all get butterflies in our stomach. We all have worries. We all have things that make us fearful. When it relates to our health, what we're really looking at is, as your expert said earlier in the segment, checking for things, being overly anxious about things, being overly excited, being overly excitable, and just being agitated overall as it relates to our health. So that's generally what we think of when we think of health anxiety.
And so then what's unique about how COVID-19 may be making this worse?
Well, part of it is because it is a pandemic and because we've had these real serious consequences to how we live our lives day to day. So there's always something in the news. Whenever we watch the news, we understand how the rates are going up of infection. We understand things like who's being negatively impacted by it. And we have these precautions that we have to take by being asking to stay at home. And so when you have all of these things together, it's like a perfect storm of creating outsized worry. Now, of course, we should be worried, but I think when you have multiple levels of information coming at you all the time, it can make your worry much higher and much worse and much more difficult to cope with.
And obviously, we're also heading into allergy season in many parts of the world during this pandemic. So how do health professionals help those with health anxiety manage their fears, say about worrying about the co-worker next to them if they sneeze or themselves if they wake up with a scratchy throat?
Absolutely. So what we try to do is make sure that people don't rely on what we call Dr. Google, right? You should be aware of what signs and symptoms are related to infection from COVID. At the same time, you should also be aware and mindful of what those signs and symptoms are not. And so when you wake up with a scratchy throat, if you're sneezing, if you're coughing, we want to make sure that what we're educating people about is paying attention to the full constellation of symptoms that would lead them to worry, to actually have something to be worried about. In addition to good sleep hygiene, good eating hygiene, and exercising, we also try to encourage people to pay attention to how they're feeling day to day. I call it setting a baseline. If you're not aware of how you feel on an average day, you are less likely and less inclined to pay attention to when your worry is getting out of control. So it's really monitoring. There are things like that I encourage people to do, like practice mindfulness, and to just monitor their behavior day to day overall in terms of who they're talking to and interacting with. All of those things can really help people manage their anxieties much better.
I mean, this is incredibly useful information for people out there. Now, we did hear one of the experts say this type of anxiety may disappear once the pandemic is over. Is that something we can expect perhaps either as the pandemic eases or we reach herd immunity perhaps?
I think we can expect it to level off some. What I will say is that there's going to be ongoing anxiety, I think, and ongoing overexposure to depression because of the trauma that people have been exposed to as a result of what we've experienced for the last year and a half. So by the time we reach herd immunity and are sort of climbing out of the throes of the pandemic, there's going to be all this residual impact from grieving, from people who've been sick and are grieving having been sick and coming out of it, from people that they've lost, loved ones that they weren't able to mourn properly. And then there's also these issues that we've been forced to reckon with since we've been forced to be under quarantine, which is social injustice and racial injustice, because we've had to sit due to the COVID quarantine and pay attention to all of these things. So I would expect that things would stay a little bit high for a while before they begin to level off.
And I know everyone is looking for some sort of normalcy at the end of this, but I want to talk about the COVID lockdown's impact on socialization skills. Is there some degree of social anxiety, not just with the current environment, but how we think about how we'll be once, sort of things and activities and routines start to return to what they were pre-pandemic?
100%. My daughter said to me today, she's a teenager, that one of the admonitions she heard recently was that we may never go back to having handshakes. And that struck me as probably important, but also as an indicator of how drastically things are going to be different for us after we finally emerge from, the throes of the pandemic. And I would say in terms of socialization, when you think about young people, when we think about children, they've had almost over a year of not having these meeting these traditional developmental trajectories related to socialization. So how do you learn how to deal with bullying? How do you learn how to make new friends? How do you learn how to deal with conflict for adults as well, if you're prevented from engaging in those kinds of activities? So I do think it's a wonderful question, and we will see some downstream effects around social anxiety, socialization as a result of the pandemic.
And just quickly, obviously, people have had to come up with a variety of coping mechanisms just to get by, some healthy, some unhealthy. How do you recommend people go about addressing their fears or concerns 1 year post-COVID?
Absolutely. So I think taking stock is important. Recognizing and being grateful, although it sounds cliche, grateful for the things that we still have. If you have a roof over your head, if you have food that you're able to eat, if you're able to be with most of your loved ones, I think these are the things we want to attend to and be grateful for. In addition, I think it's important to begin to be self-aware. I always preach self-awareness. I think many of us just kind of go through our days from moment to moment to moment and never really have an opportunity to sit and take stock. I think having an opportunity to pay attention to where we are today in the moment. We call that practicing mindfulness. If we can do that, that helps to reduce anxiety because we're not worrying about what's coming ahead of us, and we're not remembering or regretting or thinking about what's behind us. Those things are super important for managing our mental health.
Certainly very, very valuable insights. We do appreciate you being on. Dr. Alfiee Breland-Noble there, psychologist, author, podcast host, and founder of the AAKOMA Project.